So there is a public health alert tonight about tick bites. State officials say they're now tracking reports of a rare but severe allergic reaction. Joining me now is Dr. Todd Ellerin from South Shore Health. And we've talked about this before. You've warned us about these allergic reactions. Governor Healy is now calling them, and I'm quoting, an emerging threat. Do you agree with that?
100%. The Massachusetts Department of Public Health is all over this. The reason it's important to report it is because if we want to monitor something, we have to measure it, okay? Why is it important? Because the Lone Star tick is going upwards. It's coming northwards, and it's been here.
So it's
Cape,
a Lone Star
the islands,
tick,
yep.
And then it creates...
It bites and it injects this thing called alpha-gal, that's a carbohydrate. And then the body develops special antibodies to it. And then a subset of people who are infected, not the majority, can develop allergic symptoms after eating red meat. That's beef, pork, lamb.
I mean, that is so bizarre to me. It seems so specific. So it's an allergic reaction, not an infection.
That's right.
Right?
That's
okay.
right. It's an allergy.
So how do you treat it? You've actually treated somebody with it. You said it was very difficult.
I've diagnosed the patient.
No, the diagnosis was difficult.
Yes, I helped diagnose. And then I sent the patient to our allergist, Dr. Michael Young, who's excellent.
Right.
And he's the one that made the diagnosis. And then, obviously, there's no specific treatment. Prevention is important.
There's no treatment?
There's no specific treatment. Obviously, allergic reactions are treated. You have to give that patient an EpiPen or that epinasal spray. They have to have it on hand. But the most important thing is you have to avoid the red meats. Sometimes you have to avoid some of the milks and dairies and things, although this tends to be a little bit more red meat. But what's very important is you need to prevent getting bitten again, because if you do, over time, it can actually resolve. The antibodies that are in your body can go away.
If you don't get bitten again. But it can't be reversed, right? So you can't take an antibiotic and then...
That's right. That's right. If you have the allergic reaction, which, by the way, can be that hives or rash, it could be anaphylaxis, that, right? 10% can be that very serious anaphylaxis, and then the other half tends to be upper GI symptoms, vomiting, and the hard part is that most food allergies occur within minutes after eating. Think peanut allergy, for example.
This one takes its time.
This takes hours. So people wake up in the middle of the night and they're vomiting, or they have this rash, or they have anaphylaxis, and they're like, I didn't eat anything recently. So it can be tricky.
So, I mean, that's beyond tricky, because what if you have that and then you eat a burger the next day? How do you even know that that's what it is? Which is why we do this segment.
That's right.
So people can watch and listen and learn.
That's right. And I've talked to Dr. Young, and he has said that some of his patients have come to him and have said they read the Globe article, or they listened to, us talk about this, and they're the ones that mentioned, could this be? And then there's an antibody test that can help make the diagnosis.
Oh, there is?
Yes, a blood test.
So tick season, of course, just started. Any cases at South Shore right now besides the one that you were dealing with? Right.
So we just, I've seen only one case so far. It was babesiosis, not Lyme disease. It's that malaria case, malaria of New England, and the patient is super sick, still in the hospital right now, improving slowly. But again, importantly, early spring is not the time where we see a lot of tick-borne illnesses. Why? There are ticks out there, but they're the larger adult ticks. Oh. It's the smaller nymphal deer ticks between Memorial Day and Labor Day where we see most of our cases.
I mean, knowledge is power, and it's good to know this information, and it's important because you said mostly the Cape and the islands?
So far, but again, it's going northward. We're the first New England state to report this, but there will be others.
No, it's really
traveling, it's heading north.
It's important information. All right, Dr. Ellerin, we always appreciate you and your wisdom. Thank you so much. Shane, it to you. All right.